We are looking at subchondral fracture, and looking at this subchondral fracture, we are also looking at a characteristics. Okay, that like if there's a subchondral fracture, they visualize it on an X-ray. There's something you see. Okay, a feature that helps us to actually identify this. That's what is known as a crescent sign. It will look like a moon shape. Okay, so they call it the crescent sign. So subchondral, you can see it, crescent sign. Okay, it's looking like a moon. Yes, it's kind of looking like a moon. It shows that there's kind of like a dislocation happening. So subchondral fracture, we say that is a break in the bone just beneath the cartilage surface. It's often seen in the context of osteonecrosis. So mostly in the hip, all right, when there's inflammation around this place, and the femoral bone is kind of like detaching from the hip. All right, that's what usually causes the subchondral fracture. So it is actually one of the hallmark radiographic features. That's like this crescent sign that we're looking at. It's like the hallmark radiographic feature. Once you see it, establishes that fracture exists. Okay, so what is a crescent sign? Is a curvilinear radiolucent line just below the articular surface on X-rays or MRI. Indicates a subchondral fracture cleft. That's a separation between dead bone and intact cartilage. It's most commonly observed in femoral head, but you can also see it in humeral head. The scaphoid, lunate, and talus can occur in these other places of the body, but most commonly you have these issues in the hip. So pathophysiology is caused by collapse of bone trabeculae due to ischemia or necrosis. The fracture may extend into joint spaces, forming an unstable osteochondral flap. Okay, so imaging features: X-rays, the crescent-shaped lucency. Okay, you see there. CT scan, a clear fracture line can be seen. CT scan will give you a more, better imaging. The MRI, fluid cleft, bone marrow edema. Okay, distal to the fracture may be seen. So clinical implication, it signals impending collapse of the joint surface, may require surgical intervention if conservative treatment fails. So early dictatement, all these things, like if you early on pick them up, all right, then you start applying treatments, its outcomes are usually better. Okay, so that's it for subchondral fracture. All right, then with its characteristics imaging sign known as a crescent sign.